65-year-old male with a history medically intractable, Parkinson's disease. The patient was initially diagnosed with Parkinson's disease 5 years prior after he noticed a subtle pill-rolling tremor. 1. What is the cause of disease? 2. What are the cardinal manifestations of PD? 3. What are the common medical treatments available? 4. What are the primary considerations for selecting a good candidate for DBS? 5. What are the primary targets used for DBS in PD? 1. What is the cause of disease? Neuronal cell loss within substantia nigra pars compacta, 60 to 70% loss at the ventrolateral tier at onset of symptoms. Dopamine loss results in excitatory activity in the subthalamic nucleus, globus pallidus interna, and inhibitory activity in the thalamus and motor cortex. STN and GPI undergo characteristic changes. Pause to analyze. Two. What cardinal manifestations of PD? Bradykinesia, resting tremor 426 Hz. Rigidity, cartwheeling, freezing, postural reflex loss. Peak age of onset 60 years. Secondary features include depression, anxiety, dementia, bradyphrenia, slowness of thought, akathisia, restless legs, autonomic dysfunction, sleep dysfunction, fatigue. 3. What are the common medical treatments available? Levodopa, L-Dopa. Decarboxylase inhibitor, carbidopa decreases L-Dopa's peripheral breakdown. Catechol-O-methyltransferase COMT inhibitors, entacapone, tolcapone. Dopamine receptor agonists, cabergoline, bromocriptine, pergolide, ropinirole, and pramipexole. Monoamine oxidase B inhibitors, MAO-B, such as racegiline and selagiline. 4. What are the primary considerations for selecting a good candidate for DBS? Good response to dopaminergic therapy, medication-resistant tremor, severe on-off fluctuations, severe dementia and/or advanced psychiatric disease are contraindications, atypical Parkinson's, poor response. Secondary features include depression, anxiety, dementia, bradyphrenia, slowness of thought, akathisia, restless legs, autonomic dysfunction, sleep dysfunction, fatigue. If ADBS is placed, what would be improved? A. Dementia. B. Postural instability. C. Tremor. D. Gait. C. Tremor. Effective in tremor, rigidity, bradykinesia, non-effective, hypophonic speech, gait, postural instability, dysphagia. Secondary features, dementia, etc. 5. What are the primary targets used for DBS in PD? A. Globus pallidus interna and subthalamic nucleus. B. Globus pallidus externa. C. Fornix. D. Red nucleus. A. Globus pallidus interna and subthalamic nucleus. Ventral intermedius nucleus of the thalamus for the tremor.